Living your best life, defining living versus living well with HIV in Canada.
Optimizing the health and well-being of people living with HIV in Canada. A community member's perspective.
A clinician's perspective.
From the perspective of Realize, the national leading organization in Canada that has been working on this issue for the past 22 years in one way or another.
Hi, my name is Maluba Habanyama, and I'm the Principal Knowledge User of the Can Live Well Planning Grant. Thank you for being here today. I'm also a specialist social media at OHTN, a community advisor at the Canadian HIV Trials, and I wear many, many hats in the sector, to be honest. I was born with HIV and have been living with it for 27 years. I remember my mom just saying, just take the pill, just take the pill. That's all I need from you. But just taking a pill wasn't going to make me happy. It wasn't going to make me well. This grant is really important to me because it's my first time being a principal knowledge user, of course, but I have been a long time advocate of just taking a medication is not going to fix things. I want to know how people define living well with HIV, other than being undetectable. How do we thrive? I'm very curious about it, and I've talked to many different communities about it, and I think bringing us together and having this talk and these activities is going to be something really amazing. I'm so sorry that we couldn't meet in person this year, but I hope everyone is staying safe, and I can't wait to further talk. And I can't wait to further collaborate.
Hi there, my name is Jason Brophy, and I'm a pediatrician and HIV specialist at the Children's Hospital of Eastern Ontario in Ottawa. I'm also the co-lead of the Clinical Care and Management Core of the Canadian HIV Trials Network, or CTN. During our most recent round of applications for funding, the CCM identified wellness research as a priority over the next 5 years. We want to understand, what does wellness mean for a person living with HIV in Canada? And we want to understand what that looks like for different populations of people living with HIV in Canada, because it might not look the same for everybody. We know that taking medication nowadays can lead to good health, an undetectable viral load, and freedom from opportunistic infections. But many people in the community have said that that isn't necessarily living well with HIV. It's more than just the absence of disease. And so we're hoping to get feedback and input from the community members from various populations across the country so that we can understand wellness and do more work in this area.
Hello, my name is Tammy Yates. I'm the Executive Director of Realize. I'm also a newish settler to Turtle Island, which we call Canada, coming originally from the Twin Island Republic of Trinidad and Tobago. And so I acknowledge the land that we all find ourselves on, and I humbly pay homage to all of the ancestors that each of us bring to this place, this space, our work, and our lives. Realize emerged from an evolving global health crisis 22 years ago, a crisis that some would argue resembles what we're experiencing today. Drug treatment breakthroughs were beginning to change the survival outlook for people living with HIV in Canada and elsewhere, but important questions of quality of life remained unanswered. For over 2 decades, Realize has served as a catalyst for change, bringing people together and creating the space for forward thinking and action to help mitigate the complex health, social, and economic challenges people living with HIV experience. We were working on optimal health and well-being before it was even given that name. Our work in access to rehabilitation, healthy aging, and meaningful social inclusion continues to break new ground in answering those critical questions about quality of life. And today, we are thrilled to be partnering with the Can Live Well team and working with each of you to move the dial forward on this issue in Canada. COVID-19 has turned the world upside down. Otherwise, we'd all probably be together in person. Nevertheless, we are grateful for your participation at this event, grateful for the technology that still allows us all to be together in new and exciting ways, and grateful for the opportunity to put optimal health and well-being of people living with HIV at the center of the HIV response in Canada. Thank you for joining us. Be safe out there.
From this meeting, we want to learn how community members define wellness and well-being for themselves. What aspects of wellness are important to them? I'm curious. As somebody living with HIV, I know that just taking a pill doesn't automatically make me well or anything like that, or thrive. Some wellness techniques that I need for myself that's mandatory is meditation, good food. What else do I need? I'm curious. Have I ever been asked that question myself? Let's talk. What do you need? As a long-term survivor who is also in her late 20s, I define wellness as being undetectable, sure, having strength in my body, having energy in my body, eating good. And when I say good, like, I do mean fries, I'm not even gonna lie. Meditation, therapy, thriving, doing stuff I enjoy, reflexology, and more, I'm sure. Praying is definitely one. Not allyship, having allies is one, and I'm very curious to know how you would define wellness coming into this meeting.
I think as researchers, we know that in order to effectively do research on a topic, you really need to understand it and define it clearly. We know that wellness for many years in the area of HIV has been really predominantly defined around physical wellness, undetectable viral load, good CD4 count, lack of opportunistic infections. But we increasingly are understanding that that's just part of wellness, one part, and there are other parts that are equally important. We know that there are mental components to wellness, there are emotional components, there are spiritual components, in addition to the physical components. And so in order to understand how to do this research well, we need to define what wellness means. And we understand that it might look different in different populations of people living with HIV in Canada. An Indigenous person might feel differently than an African Caribbean Black person. A young person might feel differently than an older person. A woman might feel differently than a man. A transgender woman might feel differently than a cisgender woman. So these are really important components to define, and also to understand what are the commonalities across these groups. And I think once we have a good definition for wellness, then we'll be able to effectively do research and hopefully improve wellness for people living with HIV in Canada.
Since 1996 and the introduction of highly active antiretroviral therapy, or HAART, HIV has thankfully transformed from a condition with a high fatality rate to what many call a manageable chronic condition for those who have adequate access to care, treatment, and support. And I emphasize that point here because even in Canada, not everyone has equitable access. Wellness, therefore, then and even now, is often referred to in medical and clinical terms. Even the UNAIDS Global 1990 targets that Canada has adopted practically refers to the clinical and medical wellness of people living with HIV. Today, early diagnosis and appropriate treatment means that people living with HIV can expect to practically live as long as the general population. This seismic shift needs an accompanying seismic shift in focus from not only saving lives, which of course is still just as important as is, for example, U equals U, that is undetectable equals untransmittable. But just as important as those is improving wellness and well-being. You'll notice that I use both the terms wellness and well-being. Part of the importance of having these discussions at this event, and as we are at Realize with partners across the country around a so-called fourth 90, is precisely to get to a common understanding or understandings of what wellness and well-being mean in a comprehensive way to the multiple and diverse communities of people living with HIV. All of us in the HIV sector and beyond throughout Canada have never really paused to do that collectively. That time is now.
Defining wellness for people living with HIV in Canada will help inform people living with HIV, key stakeholders like community members, of course, organizations. I think is really important because I think it will benefit all of us to know, as service providers, am I pushing this when I should be encouraging this? And we also need to look at, different demographics and different communities. And I think this is going to help the organization so much and our service providers to know that there are different needs, and this is what we define wellness for people living with HIV in Canada. And that's why it was so important for this group to be diverse in so many ways, because there's so many different people in the world living with HIV and in Canada, and we want to make sure that we get everybody's perspective within this.
I think by having a clear definition of wellness, this will allow us to measure it. And researchers really need to be able to measure things in order to do research on them. By being able to measure wellness, we'll be able to understand what are the determinants of wellness. What are the things that make us more or less well? And likewise, it'll help us do intervention research to see what types of things can we do to improve the wellness of our patients or our clients or our populations. And so by understanding and clearly defining wellness, I think we'll be able to move this field forward and be able to inform clinicians and researchers and community-based organizations and policymakers at the highest levels to be able to do their jobs better and be able to help people living with HIV live their best life.
This work is collective work. It is multi-layered work and must be undertaken as a 360 approach at different levels and in different ways to create a seismic shift from the primary focus being the medical clinical one for people living with HIV in Canada in order to make their daily lives better so that they can live well and live fully. This change has to be done via research, education, policy change, and practice change. All four work in tandem and are mutually reinforcing. Now, what do I mean by this? I mean that we need to undertake the research on optimal health and wellness and well-being, like the Can Live Well team are doing, to give us a strong knowledge base of what this all means to people living with HIV in Canada. We can then take this knowledge and make it accessible to all who should be hearing it. And that includes policy and decision makers to remove existing barriers for people living with HIV in achieving optimal health and wellness, and to ensure that new decisions respect and protect people and their well-being. And when we speak about practice, we put all of this research, all of the education, and all of the policy change to use in real life by healthcare providers, by HIV community organizations, and so on, to ensure that people living with HIV have the range and type of support and services where, when, and how they need to achieve optimal health and well-being.
What I hope to learn from this meeting is how you define wellness for people living with HIV in Canada. Things that have worked for you, different techniques you have, mechanisms, things that will work for you. How to respect your culture while encouraging your wellness and thriving as a person living with HIV in Canada. I'm really, really excited, and thank you for coming to this.
What do you hope to gain from this meeting? This is a great question, and I hope to gain a lot from this meeting. I've never participated in a community-focused meeting and not walked away with a better understanding, a richer understanding of the lived experience of people living with HIV. And that helps me a lot as a clinician and as a researcher. And so really that's what I'm hoping from this meeting as well, to have a better understanding of what wellness means for different groups, different individuals. I hope that we walk away having formed a good team of people who are interested in taking this type of research forward. I really hope we come up with a clear definition of wellness so that we can do this research effectively. And I hope that everybody feels like their voice is heard, because I really think that that's a key factor in HIV research. That's why we're different than other areas of research, in that we really value community's contribution and knowledge and wisdom. And so I want to thank everybody for participating, and I'm really looking forward to the days ahead.
Of all of my responses today, this will probably be the shortest one, since I recently heard something that resonated with me so strongly, and I realized that ultimately this is what I hope to gain from my time together with you all. So I recently heard the saying that community is based on a common unity. It is my hope then that all of us at this session will be contributing to build that common unity in the lead up to defining optimal health, wellness, and well-being for people living with HIV in the Canadian context. Thank you.